What's that? She has the phone number to call in. She does. I gave it to her yesterday.
Is this thing on?
She'll call in. She has the number.
Okay.
I have no idea how to work
Oh,
that.
okay.
I do have us live now.
Oh, okay.
We got started early, I guess.
What's that?
We're live.
Okay. Call this meeting of the Board of Health to order. First thing, we got two problems. Number one, we are not socially distancing, so I'm going to have to ask, if you don't have a chair, request that you go in the lobby or go outside. The other issue is a mask or face covering is required to enter all Broadwater County buildings to provide for the safety and protection of our employees, to prevent an unnecessary closure and loss of services. So you need to have a mask on if you're going to be here.
Are there masks out there, Mike?
There are some masks up here if people would like one.
So can we just wait outside then?
Yes. So everybody's here pretty much for the mask mandate. I regret to say that we do not have a quorum. We will not make a decision. However, we will follow through with the discussion so people can make comments, so that people don't have to come back here. Really, you already spent your afternoon or scheduled it for whatever to be here, but we won't be able to make a decision today. So if we want to have, let's open with public comment. You have a 3-minute limit. Please come to the podium, state your name, and we'll go from there. So we'll open with public comment.
Do I have to wear it to talk? Do I have to wear the mask to talk?
No.
Okay. Tim Poole, Townsend. I'd like to comment in support of no further mask, if not request and encourage that we remove the mask mandate in Broadwater County. I am carrying a flag, and the purpose of carrying the flag is to symbolize America's freedom of choice, and being responsible for those choices. You see me on Monday mornings walking in front of Memorial Park. I'm there to represent the fallen soldiers who committed their lives to support those freedoms and to protect this country from foreigners. Fear is what drives restrictions and limitations and removal of those liberties, those freedoms of choices. The men who gave their lives would not be happy to see where America's heading right now with this pandemic and this mask requirements. They did so, they willingly gave their lives, believing that it was to protect us, to help us, to guide us. And now we're coming through the back door and restricting everybody's choices with mask mandates and all. We should be allowed to have personal choice. If a person is fearful for their own health, they should be responsible for protecting themselves by staying at home. They can choose to wear a mask. They can choose to have a vaccine. But the rest of us have our choices of not wearing masks. There's confusing information about whether a mask helps, whether a vaccine even protects or cures, or whatever term you want to use. There's a lot of confusing information. It's been a year since we imposed the 2-week restriction. And now we're looking at doing something else. And the concern is that we don't know where you're going with this. Are you going to impose greater restrictions, or are you going to free things up? The leader of our state, Governor Gianforte, has taken the position that we are responsible adults. We can make that decision for ourselves. we should be allowed to do that. My position is one, I encourage you to not impose any greater restrictions. If anything, liberalize the restrictions. Shutting down our businesses hurt our businesses. The hidden concern is what it's done to us as people. Having to wear the mask, not having a job, not having income. Those are things you need to take into consideration if you're going to impose further restrictions. I thank you for the opportunity to express myself, and I encourage you not to impose any other restrictions. Thank you.
Next person, go ahead, Jeff.
Jeff Longlinay, and I'm here representing Rotary. Just wanted to have two things. One, we've started planning Fall Fest. We have our fingers, toes, and everything we can cross are crossed, but we'll be planning Fall Fest, and I know that we'll have to get a health plan at some point, and I assume be working with you. Awesome. The second thing is Rotary was planning to have a panel tomorrow at 3 o'clock to talk about COVID in this room, and Patrick Plantenberg invited a few people. Well, things have changed where we're not going to be able to do that tomorrow. So I'm going to try to contact those people. Patrick's doing other stuff, but I thought I'd make that announcement here in case anybody's listening. Thanks.
Thank you.
Thank you.
Next.
J.B. Howick. I'm also here to speak against additional restrictions to the mask mandate, but I hope you'll understand my somewhat practical perspective. I was greatly disappointed when the governor's last mandate deputized me to serve as an officer of the court without my consent. The businesses were responsible for ensuring that people had to have their masks. We were the ones that were held criminally and civilly liable if those mandates were not met. Please understand, I'm not going to be deputized a second time without my willing and uncoerced permission. If the county chooses to have a mask mandate in such a small and unpopulated area without demonstrating substantial science that there is a real and pressing problem here that is solved by requiring everyone to wear masks, they will need to do so without the businesses being the officers of the court. It will need to be the police, and I would like to hear a plan from the county commissioners as to how the police will enforce such a mandate. I believe that one of the travesties that have occurred here is the fact that a lot of people have lost their freedoms, most notably the businesses. We were hurt in a lot of ways, financially and politically. As you consider what the needs of this county are, please remember you're representing all of us. You're not representing a disease, you're not representing a perceived threat, but the people who elected you to sit in these seats, or that requested the board to serve as counsel. Thank you.
Thank you.
Thank you. Next.
Corey Davis, local farmer and business owner. We own the corn maze out south of Townsend. And I'm here also to speak against having an additional mask mandate at a county level. I feel like we as a people are capable of choosing for ourselves whether or not we need to have a mask in our businesses. If a business feels like it needs to have a mask requirement, then let it do so. And if a business chooses not to, then let it do the same. And I agree, I think that goes for individuals as well. If I want to wear a mask somewhere, then I should be able to do that. And I shouldn't have to be afraid of doing that. And as well, if not wearing a mask, I should be able to go into businesses that don't have a mask mandate, and I should be able to go about my community without having to wear a mask and have that mandated by our local government. I believe that our constitutional right guarantees these freedoms and that we don't need to have any additional mandate. Thank you.
Thanks, Corey. Next.
Robert Michael, I'm here as manager of Rocky Mountain Supply, also asking this county does not enact any further mandates on us. And I look at this from just a standpoint of what the employees have been put through in this last year, being asked to enforce this mandate. We have no true power to force people to do this. And honestly, the unnecessary conflict that our employees have been put through by people on both sides of this. We've had people come in and freak out because of not wearing a mask, because of wanting everybody to wear a mask, being mad at us for not confronting everybody that comes through the door. That is a terrible position to put people in, especially people who are just trying to earn a living. That is not their position. That is not what they should be expected to deal with on a daily basis. And to me, that makes for a very tough ability for us to keep happy, safe employees. The second issue that I have on this is that I don't think there's been any consistency in this from the start on how things have been enacted, how things have been enforced. When I have people who are city and county officials coming in my building without a mask on, who are a part of the ones dictating this, it makes it very hard to respect that decision. So to me, I believe that personal choice needs to dictate what goes on here. The state has decided to remove theirs, and I ask that Broadwater County just follows that state mandate. Thank you.
Thank you, Robert. Next. Wendy, you have something? Or?
You want me to speak?
Yeah, go ahead.
Anyone else?
It's a 3-minute debate limit.
Yeah, timer starts
You know,
now.
I think that there's been some good points, and I will tell you this legislative session I've been hammered over the weekend over people's constitutional rights in firearms, within their ability to move freely, whether it's their ability to attend church or functions or group settings. And as Corey, I think it was Corey said, I think it's important that we realize that we are a free nation. I know Tim said that as well. And I think that it comes down to personal responsibility to make the right decision for whatever you're in. I don't feel, and we think we all know that I don't feel that the government has the authority to dictate what a person does with their body. We can't mandate that kids get vaccinated to go to school. We've already been down through that. I'm not sure how we find it that we can make people get vaccinated or wear masks. With that being said, you heard it from Corey or somebody, who's going to police this? Not me. I don't have the ability to go around and chase people who are not wearing a mask. What Robert said about the store is correct. I've been in there where people have gone completely crazy on somebody else in there for not wearing a mask. I've seen it on the other side where people are going off because they are wearing a mask. And we've created this division with our own community, with our own society, whether or not somebody has a piece of cloth over their face. And that is the most ridiculous thing that we've ever seen in our lives. We should treat each other like our neighbors, our friends, like we used to. And I think that if we go down the path of enacting further restrictions and guidelines based upon our own beliefs and our own biases and our own prejudices, we're not doing the job of what our constituents have elected us to do. And it's a hard pill to swallow, and I feel that there's somebody probably burning a hole in my back right now. But we have to look at everything as a whole. And like I said earlier when I started, I have been beat up 7 ways a Sunday over the Constitution and whether or not I support one thing or another based upon somebody else's belief. And this is one of those things that we really just need to give it right back to the people and say, you're big boys and girls, you do what's best for you. It's not the government's position to tell you how to live your life. If you're breaking the law, that's one thing. If you're not, you're just a good working, hard working American. I don't think it's our job to do anything with that. And I don't know if Corey has the time in his office to be chasing every complaint because people aren't wearing a mask or refusing to wear a mask. It's a double-edged sword, folks. It doesn't matter which way we go. We're going to make somebody mad, and that's just reality, I guess. But I think most people are going to come back up to this are going to understand the same thing. And I think that really let the businesses decide. If they want to require masks, let them require masks. If they don't, they don't. If the school wants to require people to wear a mask to enter the building, just like the county has done, you have to wear a mask to enter the county building, then do so. But mandated across the county, I just don't think that that's the wisest decision, in my opinion. So that's all I have. Was I under 3 minutes?
A little bit more, but only like 10 seconds, so that's huge.
Thanks, Gwen.
I also want to speak on behalf of the business owners and our community here in Townsend. This year's been a tough year. I think everybody in this community wants everyone to be healthy and safe, doesn't matter the side you're on, I think that's the goal. But we have a lot of division here, and this is a tough year. I do think it would help with the division if the community was able to choose on their own whether or not to wear the mask. I really think if we push this mask mandate, it's going to make the division even worse. It's stressing our businesses out. Our local businesses are having a hard enough time making it as it is. It's actually very sad. We have a lot of new people that are moving to the community, absolutely, but our businesses are stressed. Our businesses are having a hard time keeping the peace. Our sheriff's office is stressed enough. I know our children, our families are having a hard enough time with this, and I'm guessing the teachers and the faculty, they're struggling too. They're having to mandate something that half the people or 3/4 of the people don't want. But I'm asking you to look at this as a whole for our community and to hopefully help bring the togetherness back and the positive vibe that I know Townsend has, especially with the events that may be coming up. I do think if the state felt the need to mandate this further, the state would. The state has lifted it, so I really think it's an outreach for our county to impose this further. So, and I know that this is a hard call for everybody to make, and it's not something that would be fun. I would not want to be in your position, and I do want to thank you for your time and what you put into this, but please don't make this a mandate that is going to stress our community even more. Okay.
Thank you.
Thank you, Jenny.
Can you have your name, please?
Jenny Bonzer.
Thank you, Corey.
Anyone else? We just had the door shut because of the echo. Anyone want to come in?
And also,
I'm Brad Rock, K-8 principal at Townsend Public Schools. And first, I'd just like to acknowledge that I appreciate all of these independent business people and citizens being here, and I certainly understand what they've been through, and they are in a very tough position, and they are certainly the people and the businesses that make our community what it is. And at the school, if there's anything we value, it's our relationship to the community and to those business people. I'm asking for your consideration and your support for the school to continue to impose a mandate for masks on anybody that enters our building. I believe that Townsend schools, our primary responsibility is the health and safety of our students, staff, families, and community members. And I believe it's really important that the school system stay open, and that's something we have worked very hard to do. And without us being able to keep our doors open, we can't help support those local businesses who depend on employees being at work, depend on the money coming in from the community if people are at home taking care of their kids. So I would just ask for the, I guess, the blessing and the support for the school to continue a mask mandate. Thank you very much for your time.
Thanks, Brad.
Thanks, Brad.
Jason Noyes, Townsend School Board. Again, I would just like to extend our thanks to the county and everybody in the community. It's been tough on everybody. again, I'd just like to reiterate what Brad shared. Tonight, the school board will meet formally and make a decision for the district to keep a mask mandate in place, and we would just ask the county to support that. I'm elected by the people of Broadwater County. I like to think that I have the respect of those people that have put me here, and the decisions that we make. And the decisions that we make are about strengthening and continuing education of our students, keeping our students safe and keeping our students healthy. And that includes our staff. The greatest risk we probably have is an outbreak that takes a number of our staff out of the building. If we don't have staff, the school has to shut down, and we have to go back to some form of remote learning. We did that last spring because we had to. We didn't know how to deal with it, and we made it through. But right now, our students are doing better in keeping their education going because they are in school and they are in class, and that is very important. You look around the state, around the country, schools that have not been able to keep their kids in class, those students are struggling. We want to do everything we can to keep our students in class. Keeping the masks on, social distancing, the cleaning, all of the mitigation strategies we're using, they have worked and they will continue to work, but it is the only thing that will keep our kids there. You asked those kids last year that lost the last part of their senior year, those kids that didn't get to participate in those spring sports. If you go back and ask them if they'd come back to school and wear a mask to be able to participate in that, I guarantee they would do it. It's important for these kids to be together, to be in class in front of a teacher. And we just ask that you guys would all continue to support that. And I hope the community can continue to support that because the kids are doing good. You can go in the school. I've spent a lot of time in the school. The kids are doing good. They're handling the masks. They're happy to be there, and they want to stay there. Thank you.
Jason,
Thanks, Jason.
Current policy.
We have the mask mandate
Is
in place.
that from the previous directive from
Correct.
the governor?
As of Friday, we put out a statement that said that it would continue. Tonight will be the first formal opportunity that the board has to come together to make that official.
Thank you.
Thanks, Jason.
I'm John Hedstrom. I'm a local business owner. I'm going against the mask mandate. I have never required them in my store. Almost everybody in this room has been in there without one. I think that the federal government, even having anything to do with this, much less our county government, is being hypocritical when we will allow an abortion that guarantees to kill a child, and we're worried about a potential thing if you can't take care of yourself. Put your face mask on. If you're worried about it, put your own damn mask on. The rest of us, we're going to go on with life. Thanks.
Are there more people out there? Thanks, Teresa.
I think you were standing over on this
I know
other
that I
side.
was too.
Anybody else want to make a comment?
Hi, I'm Samantha Russell. My mom and I own and run the local restaurant here in town called Bread and Butter Cafe. We've only been open for a couple of months, and it's been challenging for sure. We've actually had to recently be closed last 2 weeks due to local mandates, state and locally. And I just wanted to say that I think people have a right to choose. And I think if you want to wear a mask, wear a mask. But if you don't, you don't. And I say to stop the mandate. So,
Thank you,
Thank you.
Samantha.
Is there anyone else? We need to figure out.
I just told them if they just wanted to come in one by one, as somebody came in.
All right, just want to take the opportunity to thank you folks for having this forum. My name is Eric Wilkerson. I'm the superintendent of schools here in Townsend, at least for a few more months. And I guess what I'm asking is that the County Health Board support the school's hopeful decision to continue with the mask mandate. Again, you've already heard this, but our goal is to keep our doors open. And if we get rid of the mask mandate, I think in the school, I believe that we're going to have some issues with the spread. We already have issues now, even with the masks. But I think it'll be enough widespread that we're going to have a hard time keeping our doors open. And I think it would be a burden on our community to close our doors again. It causes daycare issues, people having to take time off from their jobs. So I just ask that the County Board of Health support us, hopefully, in that decision, if that's the decision made this evening. Thank you.
Thanks, Eric.
You send in the next person, Eric.
You betcha. Whoever would like to go next, they're ready. I'm not sure if anybody else wants to talk.
Okay.
Real quick, just a question that came to mind. You know how the school is speaking about keeping the mask mandate for their purposes? The county, I pray and I hope that the county doesn't take that into consideration with running the mask mandate for the whole county. If the school wants to implement the mask, that's totally understandable. They have a lot of kids, a lot of teachers to keep safe. Absolutely. But I really hope that you don't put that into consideration and say, well, the school's going to do it, so we really feel like the whole county should. That's just my feeling on it. So.
Okay. Is there any other comment? Okay, seeing none, I guess we will move on with our agenda. What's
So we
that?
do have,
Oh, okay, yeah, go with those.
all right, Doris Mengay says, I would like to remove mask mandates in Broadwater County. If people are sick, they need to stay home. Thank you. Sharon Doig, people don't stay home when they are sick. Brenda, I don't even know how to pronounce her last name, Defenderfer. There is zero evidence of transmission of the virus in school settings. I believe the strain and hardship on our children is far worse than this virus. And she says again, if people are afraid of getting sick, then they should stay home. Individuals are responsible for their own health and comfort level. Sharon Doig again, work in a hospital with COVID patients. Brenda, they are handling the masks. In other words, they are being conditioned to comply, and some people wish for that training to continue. I honestly cannot believe that this is even under discussion. And then again, there is zero evidence of transmission in school settings.
That it?
That is it so far.
Okay, thank you.
Mike, if I can.
Yes. You got a half minute.
I know. You know, when I listening to that conversation that just occurred, and I think that's one of the things that I was trying to address earlier, is that division that we've created. And it was apparent just in that conversation right there, is there's people that are frontline health workers that are seeing this from the health setting side where COVID is real and it does affect people's lives, and it has taken a lot of lives. And then you also see people that look at it from the other spectrum as this is a compliance issue from the government. And I think that's a huge realistic issue that we are seeing right now. And I think you've seen it in the room today where people are like, look, we're over here. If we want to get sick, we want to die, let us do it. Many other ones, I don't want to get sick, I don't want to die. And we as a group need to figure out exactly how to bring that together so we don't have that division and those type of conversations that occur on an hourly basis, if not a minute basis, within our own county. And I think it's important that we look at that and try to find what's going to work best, because we're going to have angry people on both sides of the aisle. Not to say this is a bipartisan issue by any stretch of the means, but it sure feels like it. And not to bring politics into public health, but that's how it feels at certain junctures. So I just wanted to bring that up as
Okay.
well.
Thank you.
Yes. So I understand you don't have a quorum today, so you won't be making a decision on this today. Is that correct?
Yes.
When do you think you will have another meeting? I mean,
Probably,
a week.
I think we could try for next week or the week after to get a quorum lined up. I don't think that it would be wise. Maybe it would be wise to delay it a month. I don't think so, but I think we should probably try to get a quorum together when we can have a meeting. And the other part is, where are we at? I mean, if we can't have a vote today. So do we not have a mask mandate in place, as we were going by Bullock's directive before? So if we're going by Gianforte's directive, then we don't have a mask mandate in effect until we pass a motion to have it, such or defeat it, whichever. So are we not? We don't have a mask mandate in force right now.
Well, that's correct as a general rule. And then, so what the governor did and the previous governor did, and it's because it's what the statute says. The statute says that if the state issues a public health directive, it does not preempt a local government health body, in this case the Board of Health, from enacting a more restrictive mandate. And what this county did is basically just follow the state one. With the state one now having no mask mandate, the county does not have a mask mandate. The exception to that is, I understand the county commission did pass an order for if you're in a county building to wear a mask, okay?
Yeah.
So that would be in effect regardless of what the Board of Health does. And by the same token, the school board is not prohibited from enacting a mask mandate for school activities, property, et cetera, including extracurricular, under its authority governing school activities. I would urge the board to follow the recommendations from the school folks. They know this issue, and they know the needs of school activities better than this board does, and they can probably adjust to any changes that are needed on a more responsive basis if they do that. So when the board meets, I hope that whatever the board does, it will not preempt the school board from enacting its mandate. Having said that, the other thing is, the question I have, and I've studied this pretty deeply, and it's not clear to me what would be, if there's anything in the directive dealing with healthcare facilities regarding masking. And I don't know, Sean, if you've had a chance to figure that out. So hospitals, nursing homes, assisted living facilities, they can set their own policies as a business or an organization and say, here's what you need to do. And I assume that's basically what they're doing. But I'm not seeing anything in here specifically having a mask mandate for any subcategories. They're basically saying there's no general mask order, and individuals, local governments, any particular types of businesses, you guys go ahead and enact whatever regulations you think are appropriate for your activity. Do you agree that that's correct?
I think it says, that you should follow your industry best practices throughout the document.
Yeah.
So if it doesn't address it specifically for healthcare, I think it could be kind of implied that you follow the industry best practices.
Yeah, so CDC guidelines and industry best practices. And I think the next question is, I have also studied this in depth, and I'm not seeing where it has the quarantine isolation measures as a directive in this. And I know we're slightly off topic, this is masks, but do you agree with that?
Yeah, I don't see it.
So that's one thing I need to follow up with and just say, so it may be, so assuming that even if the board says no, we're not going to do a mask mandate countywide, the board may still need to pass something that says that if you're a contact, you need to quarantine until you're tested, or whatever the lapse of days is. If you're positive, you need to isolate for that period of time until you're recovered. Because if this is the sum total of the directive that was issued last week and that I'm holding in my hand, that I'm not sure where that puts the quarantine and isolation orders. So I know we're off topic, but I will say and I've said this to this group and to the commission, from a county attorney point of view, enforcing that is a much bigger deal for me than the masks. I mean, the sheriff and I have talked about this quite a bit, and, you know, I don't see us running around effectively enforcing a mask mandate. If you're not enforcing it, it's kind of a pointless exercise. That's the same thing I told the governor a year ago before he did it, Governor Bullock. I said, don't enact something you can't enforce. Encourage people to do it. I'll continue to wear a mask regardless of what the board does. But for me, if there needs to be an enforcement mechanism on quarantine and isolation when you have a positive test, I think that's the place where I'll know before your next meeting if we need to have something clearly enacted there.
So will the courts still require people to wear masks?
The courts will, yes. So
Courts are?
Yeah, when you go up there, you're under the authority of the judge. The judge will tell you you're going to wear a mask in my courtroom. And that was kind of a guideline from the Chief Justice of the Supreme Court, but then our district courts adopted a rule, our first judicial district court adopted a procedure that applies to all the courts in Broadwater and Lewis and Clark counties. That includes things like if there's a prisoner in custody and they have to be seen, unless their lawyer specifically requests, they're going to do a video call from jail to the court. They're not going to come in person. Or if someone gets transferred from between facilities, and the sheriff's office is doing this already amongst themselves and with Department of Corrections, they're going to ensure that that person's been 14 days clean before they just start taking them and their germs all over the state. So there's a lot of things that are already in place that will remain in place because the courts have put those in place. So.
Thanks, Corey.
Thanks, Corey. Mr. Chairman, I would suggest or voice my opinion that we have a meeting sooner rather than later.
Okay.
Whether that be next week or as soon as we can confirm that we have a quorum.
Yeah.
I think the residents need to know.
Okay. And I don't have a problem with that. We'll try to get a meeting set up probably for next week.
That'd be great. Thank you.
I can tell you most of the counties are actually having their emergency meetings today. So a lot of other counties will be making the same decision. So I think the sooner the better, just so we don't cause a lot of confusion in the community.
Okay. What are neighboring counties, Mar, Jefferson, Lewis and Clark, and Gallatin doing?
As far as I know, Lewis and Clark is they're going to keep the mask mandate.
Okay.
I don't know, I think Jefferson's meeting is today. There's a lot of them that are today.
Okay.
I have a meeting at 3 o'clock with the state, and so we should have a lot of more information on what other counties are doing.
Okay.
So Gallatin eased their restrictions on business hours. It was, I think bars were the specific item, is that right? Mm-hmm. They removed that a week ago. I was on a call with some state folks yesterday, and they're thinking Yellowstone may lift their mask mandate in Yellowstone County, but they're not sure. Mar County's not going to have one. I think Gallatin probably will keep a mask mandate. And then I think everyone is, depending on the county, looking at whether they're doing any, gathering size restrictions. And I think generally the big counties are still doing those on a case-by-case basis where you basically get a permit and you go through your protocols. But as far as the size restrictions, I don't know if that's all over the board or if, I don't know, maybe you guys would know better what you're hearing, but I'm hearing the 25-person thing is going away kind of everywhere. But I don't know. I think maybe Gallatin and Missoula might be Lewis and Clark might be the three that might be the most restrictive. Does that sound right?
Well, I know Lewis and Clark, just from the school standpoint, my daughter's a cheerleader, and we're now allowed each student is allowed 4 guests to come along. So they have definitely eased up on that limit and that number. I think it's something that we should definitely be considering and it's not to limit these activities or these public gatherings, I feel like we had a good method for helping the community meet the needs of dealing with COVID. I just want to remind people that, we're not through this yet. And whether it's the mask, whether it's masks or no masks, it's not just masks. We have to do it. We have to take it this seriously. And as a whole, we still have to consider doing social distancing. We don't want to have confined activities where we're not considering COVID. And, we still have to wash our hands, right? I mean, it's simple. There's a lot of little things that we just need to continue doing because they make sense. They're good, scientifically backed activities. So, just remember that we need to continue to do that. Whether we're wearing masks or not, the reality or the thought of personal responsibility, what does that mean? Look it up. It doesn't mean you just get to have a free-for-all. It doesn't mean that you don't have to consider your neighbor. It actually means you have to take more into consideration. Think about what your neighbors are needing and what you need to do for your community. That's personal responsibility. So just remember, as we go through this, what that means to take personal responsibility. It's not just a free-for-all. So not to be on a soapbox, but I think that we definitely need to consider some sort of threshold for public gatherings, not to say that they can't do it, but to just say, hey, reach out to our office. I feel like we did a good job working through plans throughout the fall. We had a Halloween activity, we had the Christmas activities, and I don't think we saw any surges of COVID because of those activities. So I think it's just an opportunity to remind people, wash your hands, have some, don't hand out free food or, just things like that. So I think it's important that we continue to do that. So it'll be something that I would say beyond the mask thing we need to consider, even if it's just getting a list of recommendations. It's the same thing when someone comes to my office for, if it's a nonprofit that's going to have serve a meal, they're exempt, but I give them recommendations. I remind them what temperatures they need to cook meat so they don't injure the people that they're trying to help and that type of thing. So I think that we need to do that. And I also think we need to remind people, once again, getting back on that soapbox, what personal responsibility, what that really means, because it's not defined by the governor. And it sounds like it should mean that I get to do whatever I want, but it really, as we think about our communities, we need to be thinking about it as a whole. And that obviously is, we want to keep the businesses open. So what do we do to keep the businesses open? Sometimes it might mean we have to throw a mask on so that we don't pass on COVID-19. The other thing I want to talk about a little about, I guess I'm kind of jumping in here, but about part of the reason that masks are important is that we have variants coming up now. We have a mutation of a virus that is now becoming more, it can spread quicker. We're not seeing that it's actually causing death at a higher rate or that it's having worse symptoms, but we don't know that that's not going to happen. And the way that the virus creates a variant or becomes a variant is through mutation. And mutation can only occur if somebody is sick, because the virus isn't out in the environment growing on its own. It has to be in a person. It has to be in an infected person. And the only way that a variant can occur is if that virus is allowed to replicate, multiply, and then boom, it has a little mutation. And that mutation is what creates that variant. So we need to keep that in mind as we move forward on anything. Once again, personally, I'll be wearing a mask. I think it's my personal responsibility to do that. I think it's our community. We need to think about that in certain situations for sure. We need to make sure that this virus doesn't turn into something worse than it is. And the way that that's done is through all the steps that we've worked very diligently on. Washing our hands, keeping social distance, wearing a mask when appropriate, and sometimes not getting together with all of your family. And it's been hard. It's been hard for all of us. So I think that's all I have. on that.
I have a question to ask.
Can you come up to the microphone?
Yeah. I have a question to ask. How many times have we all touched our masks today during this meeting? I keep going like this, to be honest, and mine's ticking me off. So I touched the doorknobs, I touched the chairs, I did pat somebody on the side of their arm, and I touched my mask. I can't tell you how many times. So I do believe very strongly it's one's personal responsibility. If you want to wear a mask, you put that bugger on. If you feel like you need to be safe, you put that mask on. But if you don't, I mean, out of respect, like when I'm working with older clients or clients who are concerned, as a business owner, I do put that mask on. Absolutely. But at the same time, I know I've touched my mask a million times, and every time we go into a business, who knows how many people are touching their mask. I think it's more important to make sure that they understand, here we go again, the personal responsibility of washing hands, keeping your doorknobs, your light switches, everything clean as a business owner, maybe implementing your cleaning better, more, I don't know. But at the same time, I feel like the masks for businesses are kind of obsolete right now unless someone feels that they need to. Because, I mean, the germs are spreading from fingers to, you know, whatever the case may be, mask to mask. But the whole, if you choose to wear a mask, that's great, but that scares me for our businesses, big time. The schools, if they choose to, they're private entity over here, that's great. But it does scare me for our businesses. So.
Thank you. Yes?
A quick question. Are you going to be considering only the issue of masks, or is there going to be a discussion for a larger, more broad issue? Because the sanitarian brought up a lot of good questions. They weren't addressed here by the public. And some of them don't make sense. We don't shut down businesses because of the flu. Diseases never go away. Once they're here forever. The idea that we might impose restrictions that we don't do for other issues that cause death just because this is COVID, that doesn't make sense. So if you're going to discuss something more than just masks, that meeting's going to get a lot bigger than maybe you thought. But if you're only considering masks, I think perhaps you've had plenty of input from today. Are you going to be discussing more than masks with this decision?
Well, I think then that the next meeting we'll have will be pretty much confined to mask if we can gather a quorum.
And there will be a later discussion if you're going to try to implement something more complete, more involved.
I would think so.
Okay.
As a sanitarian, how important is it to maybe have businesses have reminders up of washing hands? I mean, does that help to have the reminders up versus trying to say, hey, you have to wear a mask? I mean, is it helping? Maybe that would be something the county could do, is a county flyer, and if the businesses would like to put the county flyer with the reminders up, you know, just to stay clean, wash your hands, great. No, I mean, is that helpful versus trying to force a mask, trying to make sure people are cleaner?
We have, throughout this process, taken the stance that, and it, you know, through Corey, is that education is way better than trying to do enforcement. Now, if somebody is sick and giving other people COVID, we're going to make, you know, that's not okay. But we have really tried to go with education and try to promote that side of it. So absolutely, if we can provide some kind of educational materials, we will do that. We did that at the very beginning. We handed out a lot of posters. Not so much to maybe individual businesses as, well, we did walk up and down Main Street, or Broadway, excuse me. But I deal mostly with food, you know, establishments and licensed establishments. So those establishments, we definitely spent a lot of time working with. You know, Robert from Rocky Mountain Supply, he and I talk a lot because it's so, he's just struggled. And Town Pump, talk to those folks all the time. And Bob's Market. I get a call, or we were getting calls, Teresa and I, at least twice a week about those establishments until recently. But almost every week we would get a complaint about it. And we would talk to Bob, and they were trying as hard as they can as well. So I think it's all, you know, we will do our best to continue to get educational materials out there that are based on science and And that, so, yeah.
And considering the mask mandate, the other thing that's kind of scary is if you make a decision on the mask mandate and there's no decision on what happens if somebody is positive and quarantine, I think that that almost needs to go into the same meeting. I think that whatever procedures you have going on, it's going to have to consist of what happens if somebody is positive. Do they have to quarantine? How many days? Is that lessened? Is it the same? Because I don't think that you can make a decision and say, okay, no masks, and if somebody is sick and whatever, they can just run around. I think that's going to be a liability issue for our county. I think that you're going to have to decide at the same meeting what happens quarantine-wise, and if you have sick ones.
That's not even an issue. That is not going to go anywhere. This is a communicable disease, and quarantine and isolation is not going anywhere. That's not even on the table.
So is there nothing like the county-wise, are you guys going to lift the quarantine? Like, is that going to be in place? So will somebody have to be quarantined if they're sick?
And the only reason I brought that up is because when Governor Gianforte issued his first directive right after he came into office, he, with the exception of modifying a few things from Governor Bullock, he said all other directives remain in effect. With this one, there are a number of things that were rescinded from Governor Bullock's directive. So it's not clear to me from the four corners of this document whether the quarantine isolation directives from Governor Bullock last year are still in effect. So what I'm going to recommend, if after further research, I find that they're not in effect, then I'll recommend that this board does adopt those ones that if you're a contact of someone or you know whatever, you go through your quarantine, you get tested, and if you're positive, so generally quarantine is waiting for confirmation that you're positive. Once you're positive, it's called isolation until your disease is run its course. If we go through all this and we find that maybe that this isn't clear, then I may come back and recommend that the board enact that, just so it is crystal clear for the county. I mean, I'm not telling people don't follow it, still follow it. And then the other thing is, the question for the board may be, they may not want to set a set number of days, because as CDC guidance is updated, a few weeks ago they reduced the quarantine length from 14 to 10 days, for example. In 6 months, maybe with a new strain or something, they might increase it. So, but whatever that is, if it's not clear, then I'll come back and recommend the board make it clear.
I can just see like on both sides being so
Hold on
divided.
just a second. I'm getting comments on my phone. People cannot hear your comments.
Oh, okay. Yeah, so online they can't. I am guilty of that too. I was chatting from down there and no one could hear me in the microphone. So,
Okay.
So, yeah, people want to hear your comments.
if you want to talk to any, come on up. Well, I'll defer to the chairman.
I guess the only thing is, I think on both sides of this, for people to actually feel comfortable, because there's going to be somebody ticked off on each side no matter what you decide. But I think they're going to have clarification on that in order to have understanding.
Okay.
Do we have any online comments?
Okay, so Bobby, Broadwater reporter, to keep from a 2-week or another month delay, can the Board of Health meet via phone conference for a vote with Board of Health members making a quorum? Joey Drake, I wrote in with a comment and sent it into the Broadwater Commissioners email on Monday. In short, it was against the mandate, but allow businesses and public entities to self-impose restrictions. Brenda defended her. If we are responsible for others' health, then I propose that we begin policing what people buy at the grocery store. Obesity and ill health are a far larger threat to community health than this virus. Sharon Doig, good point, Broadwater reporter. And Sharon Doig, I can't see who is talking, but thank you. Okay. Joey Drake, a new variance. If you do not know what the impact will be, then it's not based on science. That is it for now.
I do have one other comment. This letter was sent in by Georgia Munns. Now that the state mask mandate is lifted, I understand that you will be discussing the mask mandate in our county today. Whether or not face coverings are effective in prohibiting the transmission of a virus can be discussed all day, and scientific evidence supporting both sides of the argument can be cited. Hence, to me, the issue is about our individual liberties. I encourage you to trust the citizens of Broadwater County to make their own choices. Businesses and churches can choose to require masks or not. Individuals, knowing their own specific health needs, can choose to wear a mask or not. As a board, I hope you will make recommendations but not mandates. Thank you for consideration. Sincerely, Georgia Munns.
And if I might add, I've been keeping track of the emails as of about 2 hours ago, between the ones sent to the commission email, my personal email. I think I was at 43 total. If we didn't get back to you, we read them. I read them. I'm sure the other commissioners did. We have paid attention to them. So I just want the general public to know that.
And really, the average on those emails is about 50-50, so we're not getting any help from the public to make a decision. So if there's nothing else to discuss with the mask, I guess we'll move on to our agenda. Let's see here, old business, public health officer, Doc. He's
just
gone.
left.
That must have got bored. Public health nurse.
I have no old business.
Okay. Approval of the minutes 2021, January 20th, 2021. Can't do that either.
Yeah.
Cooperative agreement, which one is that with the Department of Health and Human Services, Sean?
Yeah.
Is that cooperative agreement that between?
Well, we have to have a quorum for that as well.
Okay.
And in fact, I know there's a 2 o'clock planning board meeting scheduled for this room. And any of the other things, and I'm sorry JJ came because I wanted him to be a part of some of the other items that I have to bring forward, but I think if we could bring those forward at the next meeting, that would be okay.
Okay.
Since we're kind of running out of time. Sorry, JJ.
And the planning board, just so you know, Sean, the planning board knows this may run long.
Right, okay.
So we guess we move on to report from the public health nurse. You got anything for us, Teresa?
Yeah, just some numbers, I guess.
Okay. So I just want to give you a little bit of an update on actually what's going on in our county. We currently have about 20 cases. We've had a total of 397 cases with 5 deaths related to COVID. Montana's had 97,759 cases with 1,332 deaths. So far, we have vaccinated 670 people with 130, actually 50, because I did 20 today, that are fully immunized. What I'm hearing right now, we're in phase 1B. Broadwater County gets 100 doses per week allocation. Sorry. And the hospital gets 100 doses 1 week, and then we get 100 doses the next week. We are sharing a list so that everyone is done in the order in which they signed up. The state took back about 19,500 doses from Walgreens and CVS. They over-allocated that for the long-term care facilities, and so this week they're going to make a decision on how they're going to allocate those doses. So if we're lucky, we'll get some extra doses out of that. So So we probably have a list of, I don't know, probably 600 and some people in phase 1B. We're probably 3/4 of the way through that. We don't have any idea right now when they're going to open it up to 1C. So currently we're just taking names and numbers of people that are in 1B.
1C is 60 and older, is that what?
70 and older, and
That C is? I
oh,
thought-
C, yes.
Yeah.
Mhm.
C is
Yeah.
60 to 70 or
Yeah.
60 to 69. Okay.
Essential workers, we get a lot of calls about businesses who want to get vaccinated and they come under the 1B. And so we're gonna try to do, you know, those people as quickly as we can. Everybody has to stay for 15 minutes, so, you know, in our facility, we can do we have 3 rooms designated for vaccination rooms, and it's just a slow process. Takes a lot of time to schedule. They all have to have a IIS number, which is a immunization number for the CDC through the state of Montana. It's quite a process, really. I would invite anybody to come over to my office any day that we're giving shots and see how crazy it is. We're doing the best we can. I think we're rolling through them very quickly. We've been working very well with the hospital. I don't know, does anybody have any questions? It seems like there's some confusion, but I've had it in the paper. We just got our Facebook page up and running, so we are not going to take you know, anybody's name and number off of that. It's strictly going to be informational. So we're hoping Cammie Simmons, my LPN, got that up and running, and so we're hoping to put something out daily on that as much as we can. We're short-staffed, so it's really hard to, you know, get that kind of work done too. So, but you know, we're still taking a lot of names. People are still calling in, and we would encourage them to keep doing that, so we can get those vaccinated that wants to get vaccinated.
Teresa,
So-
can you repeat your first number, your vaccinations? I missed it, I'm sorry.
Oh, yeah, sure. It's
6 something.
670 doses given, and as of today, we would have 150 fully immunized. The hospital has the allocation for this week, and they are booked every day.
Thank
So
you.
they'll be running through that 100 doses quite quickly. Then my 100 doses will come on Tuesday. And so, you know, we're trying to get the 100 done in a week and a couple of days, if at all possible. So hopefully we'll get through this phase probably by the end of February. I'm telling people end of February, 1st of March. And I think then we have to wait for the governor, of course, to open up the phase before we can even start it. So whenever he does that, we will start with that phase. So we have lots of statistics. I don't know if anybody is really interested in that. We do have an outbreak at the school. We did have, we had 11 students, 11 high school students, 1 K through 6, 1 7 and 8, and 1 teacher. I think that we're getting to the end of that right now. I did have 1 student this weekend, and hopefully that will be over with. It started with the basketball team and just kind of ran through there and some of their contacts. So we also had a construction company that had an outbreak, which we call a cluster. We've had a few of those, and that's what we're trying to stop. So as I just really want people to keep in mind, we have no cases of the flu this year in Montana. At this time, we would have between 8,000 and 10,000 cases of flu in Montana. And I just want people to think about why we don't have any flu this year.
Thank you, Teresa. Okay, let's go to the report from the county sanitarian. Elevated arsenic levels, drain field failures, Rocky Mountain supply deviation request.
Okay, so I'll go through the top two. The Rocky Mountain supply deviation request requires a quorum, but I'll just go through real quick the elevated arsenic levels at the south end of the county. And so recently, a person contacted me after buying a brand new home down in the Wheatland area, what I call the Wheatland area, you know, back behind in Village at Elk Ridge, Wheatland Meadows, all the subdivisions back there. And he had bought a brand new home, moved in with his family, had tested as well for nitrates and E. coli, which is what we typically test for and we recommend testing for. We always tell it's a good idea to test for the whole gamut of things if you can afford it. There's a suite that you can typically get through the different laboratories for around $100, maybe even $80. So, but he found that his well was had high levels of arsenic. And with that being said, we've seen it 2 or 3 times now down in that area. It's kind of hit or miss. You don't know. It's that shale kind of bedrock aquifer where it's just naturally occurring in those shales, and you don't know wherever the wells are finished. You don't know if they're going to be finished in that where there's some arsenic in that shale. So any drain field permit that I issue now down in that area will go with a letter saying test your well for arsenic. But I'd like to see if the board is interested in sending out a letter to all the existing homeowners down there. I think it wouldn't take much. I think with Nicole's database of addresses and that, we could send out a letter just saying, hey, by the way, you may have elevated arsenic. One of the issues that I have is not only the health component of it, but that to treat arsenic, it requires, in this particular case where the gentleman called me, for every 1 gallon of clean water they get out of the treatment unit, they get 2 gallons of discharge water. So the drain field, and it's connected to a drain field that is going to get inundated with just wastewater from the RO unit, which that drain field was not designed to do that. So we need to be thinking about how those systems are going to be separated. And so that's also in the letter that I send out with the drain field permit. But there are lots of people that are treating their water already with RO unit, reverse osmosis, or just a water softener, and they're discharging that water into their drain field, which is permitted. It doesn't say you can't do that, but it's, from my experience, it's highly unrecommended. And when we see drain fields fail because of elevated water use or extra water use, a lot of times it's because the water softener has gone awry. You know, a valve has stuck, because a lot of times those are systems that you get at Home Depot that you put in yourself. It's not to the plumbing standards that you would normally put in when you build a brand new home, because they're put in afterwards. So that's my issue with the arsenic. The gentleman that is just bought a brand new home is having to spend $20,000 on a system, because he also has some sulfur bacteria or iron reducing bacteria in his well. So to get rid of all the things that he has to, it's going to cost him $20,000. And I'd like to try to nip that in the bud, if you want to say, and get those costs up front, so that somebody, when they buy a brand new home, it's already part of the package. Because as we know, we always, when we buy a home, we're typically right at the edge of what we can afford. And to think of paying another $20,000 after moving in a month, it kind of breaks my heart. So I'm trying to get that up front. And also, obviously, the public health issue is a significant issue. If there's high arsenic, we want to make sure that they're treating that water before they consume it. So, you guys have any thoughts? Do you think, I don't know what it would cost for us to send out those letters, but maybe it's 40 or maybe a couple hundred letters. I think it should be in my budget to be able to send out a letter just recommending people do it, and a list of labs and maybe even people that can take those samples. JJ is also here. JJ is a non-voting member, and JJ works in the same kind of area that we do, or that I do as a sanitarian. And I've asked him, as he does any projects down there, new projects, to do some sampling of arsenic as just kind of as a background. So we've kind of agreed to do that as much as we can. And it's an extra $20 to the already $25 to $50 fee that they have to pay for sampling existing wells. So it seems like a good cost to try to do that. So. Any questions of me on that?
Is that considered best practices to send out those letters in your field?
Yeah, so I reached out to Lake County. They had an issue with this. That's what they have done. They've actually, DEQ has kind of helped as well, so I'll try to see if they want to. Sometimes I would prefer not to get other entities involved until we let the public, as we heard, the public wants to take responsibility for themselves in this county more than some counties are willing. Some are used to a little more oversight. I would say we're not that county. So,
when you refer to the Wheatland area, is it just thinking about sheer number of homes? Is it more like the Price? Would we include the Price Road area then, or the Wheatland Road area?
So where we've seen it is
crossed over on West Farm.
It was a surprise to hear from this gentleman that got it. It's called Morning Sky Estates, which is just past Wheatland Meadows and past Tim's diesel repair there. And it's the corner lot right on Wheatland and Horizon Loop or whatever that is. So it's right on Wheatland Road. But the other places that we've seen it is Rolling Glen, which is not connected. I mean, it's actually, maybe a couple miles from there. So I was surprised to see that. The Rolling Glen ones, every time I talk to someone in Rolling Glen, I mention it. And I was comfortable with just saying, hey, we've seen it a couple times in your subdivision. But now seeing it in Morning Sky, I just felt that it was necessary to, hey, we'll just start throwing a letter. Big thing is I want the spec home builders to be put on notice that they now have to put this in their in the buy sells, not divulge it, but anyway, they have to mention that could be something, kind of like radon you do, and the realtors. So I'll probably send a couple letters out to a bunch of the realtors as well.
Okay.
For that.
Helen, are there any public comments? I'm getting text messages.
Are you? Broadwater reporter. Citizens are requesting a weekly COVID-19 vaccination and current vaccine phase report be published in the newspaper. Can we get that published weekly? Our office has received numerous requests. And she says, can this report also include the number of vaccines received by the state weekly? Sharon Doig says, yes, for that request, Broadwater reporter, I would like that. Broadwater reporter, what are the dates of the school and construction company outbreak? Vicki Rouser, thank you for the flu report. Sharon Doig, yes, Teresa. Bobby, Broadwater reporter, can Board of Health have a phone conference or Zoom meeting to make a vote for mask mandate? Can we have a weekly report published for vaccine numbers and phase reports? Dates of the 2 outbreaks Teresa mentioned, and that's it.
Okay, thank you.
You're
welcome.
Is there anything else?
I do have one last little thing, and I know I seem to always go on and on, but in this, once again, is down in that same area that we were talking about, and the soils down in that area can be very expansive or tight. They don't perk very well. but you could go from one lot to the next and have totally different soils. And we've started to see some failures of drain fields, of brand new drain fields that have been put in. Some of it has been due to installation. The contractors are maybe a little sloppier than they should have been. A couple of them I didn't get called to do the inspection on, and so there's that. But also, we give a reduction in size in the drain field if they use these things called infiltrators or gravelless chambers. And a lot of counties have gone away from giving a reduction, a 25% reduction for those types of soils. And that's something that I'm planning on doing. Our regulations say we may give a reduction. And so I just thought I would let you guys know that I'm going to stop doing that at this point in hopes that we don't, that we can save somebody the heartache of having a drain field fail. And I will tell you, last year in 2019, on December 24th, I had to go down and deal with a failed drain field. This year, December 27th, I was down just right in the same area because people have family home for the holidays, and the drain fields are designed to accommodate some extra use, but if they're already down 25% in those soils, they probably aren't going to be able to do it. And so maybe, I don't know if it's something we need to do as a board, but I thought I would let you know that because it allows me, it does say may take a reduction. My plan is to stop giving reductions in those very tight, silty clay type soils. And there's some other techniques that we're going to follow the good contractors are already following all these techniques, so.
Okay.
And that's all I've got.
All right.
Thanks, Sean.
Anything
Thank you.
else? Okay, so we will adjourn at 2:18.